One of the biggest changes in our profession is that what was used to be deemed as just weight loss surgery has now been called metabolic surgery. And the question is, why is that? This has been a recent development in our profession in the bigger scheme of things. But the reason we call it metabolic surgery is what it actually does to help change the biology. And you may have seen the video about what the biology of obesity is. But that is one of the biggest factors of why these surgeries and these operations can work so well. When you look at surgeries such as a sleeve gastrectomy, gastric bypass, duodenal switch, they all affect that metabolic component. They all affect the biologic component. So something like the sleeve, the bypass, the duodenal switch, one of the biggest things that's been looked at is that gastric hormone called ghrelin. Something that very much influences cravings and desires and wants for foods is actually drastically altered and dropped after each one of those surgeries. We know that there's other kind of neuroendocrine and hormonal changes that happen dramatically after surgery. And so what we're dealing with is a patient population when somebody's body mass index gets above 30, 35 that has this different biology and this different set point. What the surgeries allow for is kind of a changing of that to try to bring that set point back to more of a kind of a normal range where it's easier for people to adhere to a healthier lifestyle, but then to keep the weight off long term. And that is why we call it metabolic surgery, because it changes the metabolism, it changes the biology.